Today, we're talking about something that sounds strange, but it works: maggot therapy. By the end of this video, you'll understand how these tiny creatures can help wounds heal faster, cleaner, and with fewer antibiotics. We try so hard to control nature in medicine: sterile fields, clean tools, fancy dressings. But what if one of the best treatments comes from the natural world? And what if it looks like something most people try to kill? For those who don't know me, my name is Dr. Voltaire, a wound care physician. I've seen wounds that wouldn't budge with anything else unless we tried maggots. The results were kind of amazing. If you're new to wound care, or if you're feeling stuck with a wound that just won't heal, this is for you. No gimmicks, just science that looks a little weird, but works. In this video, we'll cover what maggot therapy is, how it works, when to use it, what to expect during treatment, and how to help patients understand it. Stick around until the end because I'll share a case that completely changed my opinion about maggots in medicine. Let's start with the basics. Maggot therapy is also called larval therapy. It involves placing live, sterile maggots, yes, actual larvae, on a wound. They eat dead tissue and leave the healthy parts alone. That's what makes them different from sharp tools. Debridement with a scalpel or curette risks cutting too deep or too wide. But maggots are picky eaters. They only go for the dead stuff. Now I get it, that sounds gross and a little medieval. But let's pause here and look why this method might be more advanced than it seems. Every wound has a story, and not every wound needs the same kind of attention. You might have a diabetic foot ulcer with black necrotic tissue, or a pressure injury that's sloughing and weeping. Maybe your patient can't tolerate surgery, or maybe the wound is in a tricky spot, like near the coccyx or on the heel. Let's say you're treating a 78-year-old woman with dementia, diabetes, and poor kidney function. She's got a pressure injury on her lower back. It's deep and smelly, and every time you try to clean it, she cries out. You're stuck. Now imagine instead placing a little mesh pouch of maggots on the wound, covering it gently and letting them do their work over 2 to 3 days. No sharp tools, no pain, no bleeding. Here's how it works. The maggots secrete enzymes into the wound. These enzymes liquefy the dead tissue. Then the maggots suck up the digested material. While they do that, they also reduce bacteria. They break down biofilm too, which is like the slimy barrier that bacteria use to hide. Biofilm is one of the biggest reasons wounds stop healing. It acts like a force shield that blocks antibiotics and immune cells. And maggots, they eat right through it. Now, how do you actually do this? Medical grade maggots come in sealed containers. You order them through specialized pharmacies. When they arrive, they're applied directly to the wound using a dressing that lets in air but keeps them in place. This dressing usually stays on for 48 to 72 hours. Some setups use free-range maggots, meaning they're placed directly into the wound without a pouch. Others use biobags, which are tiny mesh envelopes that keep them contained while allowing them to work. Either way, once they're done, they're removed and discarded. It's a short-term treatment with long-term impact. So how do patients react? Honestly, some are horrified at first, but once they understand the science, and especially once they see the results, the fear usually fades. One of my patients told me, "It's weird, but they help. I'll try anything." Here are a few tips for introducing maggot therapy to your patients. Use visuals, so you can show before and after photos from real cases. Avoid using the word maggots if it triggers a reaction. So try larva or biological debridement instead. Emphasize that they're sterile and they can't lay eggs. Reassure them that it's painless. In fact, many patients feel nothing at all. Now let's go deeper. What makes maggot therapy so unique is that it hits multiple targets. It removes necrotic tissue, it reduces bacterial load, it breaks down biofilm, it promotes granulation tissue, which is super important. That's 4 huge wins in wound healing. And it does all of that without surgery, without sedation, and without strong antibiotics. Think about that for a second. In a time where antibiotic resistance is rising, where surgeries carry risks, and where we're trying to reduce healthcare costs, maggot therapy checks a lot of boxes. Let me share another case. Miss P had a diabetic ulcer under her big toe. It had been there for 6 months. We tried different dressings, topical antimicrobials, even oxygen therapy. Nothing worked. The tissue was thick, black, and dry. We applied maggots. After 2 rounds, about 6 days total, the necrotic tissue lifted away. The wound bed was red and moist. Within 3 weeks, weeks, she was healing. No pain, no antibiotics, no OR visit. Why isn't this used more? Honestly, it's marketing. There's no drug company pushing it, no shiny box or expensive packaging, just nature, doing what it's always done. But we need to rethink how we define modern medicine. Sometimes the oldest tools are the most sophisticated. So here are a few key reminders. Don't use maggots on dry wounds. They need moisture. Avoid wounds with exposed vessels. Monitor for pain or patient distress. Use for 48 to 72 hours maximum and then reassess. Now here's a real takeaway. You don't have to use maggots in every case, but you do need to keep them in your mental toolbox. Because when nothing else is working or when everything feels too invasive, maggots may be the safest, smartest choice you haven't considered. Remember Mr. J? His wound has stalled for months, but after maggot therapy, he healed in just 5 weeks. He avoided surgery, reduced infection risk, and walked out smiling. That's the power of rethinking what we think we know. Thanks for watching. If you found this helpful, check out my next video on when to use silver in wound care and when you shouldn't. Stay informed and heal well.